the JAMA Network.
Michael McPhee has type 2 diabetes. Having heart disease never really entered his mind until he received a phone call from his doctor.
Dr. Muhlstein called me and said, "You've had a silent heart attack," and it came as quite a shock and quite a surprise because I had absolutely no symptoms.
That brings up the question is, should we start screening patients who don't have heart disease or evidence of heart disease but are at risk for it?
Dr. J. Brent Muhlstein from the Intermountain Medical Center Heart Institute in Salt Lake City and co-authors randomly assigned 900 older patients with diabetes who showed no signs or symptoms of heart disease to either screening CT coronary angiogram or standard medical care for diabetes. Patients were followed for an average of 4 years to see which group experienced more deaths, heart attacks, or hospitalizations for unstable angina.
We expected 8% per year to have one of those major primary events. Whether they were in the control arm or in the randomized scanning arm, only less than 2% had an adverse event each year.
The study appears in JAMA, Journal of the American Medical Association.
In these patients, 70% of them had at least some evidence of coronary artery disease by the screening study. That was more than we expected. All of those who were found to have significant coronary disease were recommended to go on more aggressive medical management.
Dr. Muhlstein says patients found to have severe heart disease did undergo bypass surgery or stenting when indicated.
This study just emphasizes that it's not necessary to screen these asymptomatic patients with expensive screening tests like CT coronary angiography. It is, however, extremely imperative that these patients receive aggressive, guideline-based optimal medical therapy.
Michael is receiving that medical care and is monitoring every aspect of his health.
I've obviously tried to improve my diet, mostly for the diabetes aspect, but knowing that it'll help with the heart problem as well.
Catherine Dolf, the JAMA Report.